So the genesis in the beginning, briefly, this effort of developing a national model health code started in 2005. CDC had a workshop, had over 100 folks from around the country, epidemiologists, health officials, industry, and one of the outcomes of that conference, and the conference was how to prevent recreational water illness in disinfected swimming pools, in disinfected venues. One of the outcomes was a request that a national model code be developed, and that would allow health departments to have some consistency, the same information, technology updated, and a consistent message across the country. Some key issues about that code was that it had to be data-driven, knowledge-based, supported by data and engineering, good science, because as you probably, everybody here in the room that's dealing with aquatics, whether you be a designer, health official, operator, a lot of what we do in this industry for decades is that's how we did it before, and we started out with something, maybe a 12-hour turnover rate. 12-hour turnover rate at one time. We get a new type of pool. If 12 was good for that, 10 must be good for this, 4 must be good for that too. And we step back and say, where did it all come from? We lose sight, if we ever did know, what the basis for some of these. So key element of this model code is delving down into the weeds and making sure we understand what it is we're trying to accomplish and what's the basis for that. What is there science behind that? Some other key points is a regular way of updating the code. Doesn't do any good to have a nice current code based on current technology. 10 years from now, things evolve. There's got to be a process to keep this updated. And most importantly, also, I think, is open access, free, easily accessible for all. Web posted, not having to pay to get it, and it's some convoluted and complex process for health officials, operators, industry get it. So those are some of the key elements of what was desired for this, for a national model code. The scope of this, the intent is, one of the key areas, it's public venues. This does not and is not intended to apply to residential settings. Public venues, and we're looking at water quality, air, and illness and health from air quality and safety. All those issues are incorporated in that. Building code issues, a big effort to, if it's a traditional building code issue on structural aspects, electrical, how do you vent a furnace, that's being deferred to the building codes as it should. So we're not trying to override or supersede that or have a parallel piece of standards for typical building construction issues. And again, it's man-made venues, meaning our swimming pools. It's not open water, lakes, ponds, streams, those beaches. This is not included in the scope of the project. Again, our vision, user-friendly, knowledge-based, scientifically supported, and what we're hoping again is and I'll get into a little bit more that this is the key is a model code, but it's not going to be forced down health departments or anybody. It's a way, that's why we say we want to transform the various swimming pool codes around the country using this information so that we're all on the same page, the technology, science is across the board, consistent, uniform across the country. That's our goal of this project. Okay. Again, the plan, can't stress enough that we want data or best practices. And I know from an industry standpoint, you designers, this is a key area. Avoid prescription. Health codes tend to be very prescriptive. Here's what you have to do. You want to get to C, you have to add A and B, and there's no other path to do it. We want performance-based where possible. That's where we have to really understand what it is we're trying to accomplish by a particular section. You have to have a good, clear understanding. Is it health-based, injury, illness, prevention, and then define the outcome and leave it open for technology and different aspects to get to that same endpoint. So we're really trying hard to the extent possible to avoid prescription and be performance-based. Again, modular, I already mentioned current and updated, free for all. And this is another key area too, revise on a routine basis. I think Charles Otto spoke yesterday about a process, if anybody heard that, on there will be a process where we're going to have to be able to update it maybe every 2 years, I think is what we're looking at, to make sure that we're current with technology. And if there's new pathogens, new issues, health safety issues, and or technology, it can be rolled into the an update of the model code. And again, the outcomes that we hope is improved operations of the facilities, adoption of the minimum standards, and improved, and this again is important, I think, from from a health department perspective, because it does contain guidance or standards for health departments to run a program. As a designer, do you want, submit a set of plans, different requirements in one jurisdiction? It may take a month's review time in one and 12 months in another, so there's going to be guidance on how to actually operate a local health department program. Again, it's not obligatory. These are guidance models, but we're looking at improved surveillance systems. If there are incidents, how do we know about it? Roll it in, investigate. That gets into data collection, and then database decision making, not just the old TITA method, take it out of thin air. Can't stress enough again, database decision making. So improving all these aspects of it will bring us back into a really sound, defensible code. And we do expect, and we do know that there's going to be a research agenda coming out of here. We keep harping on data, decision, engineering, but the fact is we're going to have a lot of sections that are just plain best practices because there's research gaps. We want to be here. We don't have the research and the engineering to get us here. Here's what we're commonly doing right now. We're acknowledging that, but also here's the research that we need and the info we need to get to be able to get us up to this A grade. So there's a big research agenda, and I think the National Swimming Pool Foundation has been one of the premier, if not one of the only ones that really actively supports research in the aquatic area. I would think this may be helpful, this research agenda. Scarce research dollars, we would hope that this would help focus and the need where research is needed and help in that effort and their efforts of supporting research. And long-term outcome, again, the genesis of this was reduction of recreational water illnesses. We do need to add a bullet here, and prevention of injuries, because this is just not illness prevention, it's injury prevention. One thing, and before we get into the meat of this, is what the MAHC is and what it isn't. I think probably most of you folks here know something about law, something about Virginia Graham Baker, and the MAHC, there's some comparisons. Is this just another VGB where we're imposing requirements? Model Code, VGB. The creator of Model Code, it's you folks. Everybody sitting in this room. It's public health and the aquatics industry, whether it be the operator, the designer, academia involved in research. We're all part of the process of creating it. VGB was a law passed by Congress. Enforceable? No. The MAHC, as we've been saying, is just a pile of paper. It's sitting here. We get done with this. It's how many pages long? It has no meaning until a local health jurisdiction adopts it at a local level. There's no force to it. There's no regulatory requirement that they must do it. It's a resource that sits there that needs to move to adoption. VGB, enforceable, yes, it's a law. Input into the process during creation, Model Aquatic Health Code, for those of you in the room that have been involved in the process, substantial input and involvement in the process of developing this. What did you have for VGB? None. It was a law that was passed down. And changed, public comment, Model Code, yes, for each of the modules, there's a 60-day public comment period for the initial posting. We received comments. Every single comment is addressed, and one way or the other, whether yes, we're making changes, or no, for this reason, we're not. And then a full document will be posted with the changes for another 60-day comment period. VGB, no public comment period. And how do you change it? Public health and aquatics. Again, this follow-up process of this conference of pool protection, or whatever we end up calling it. They'll have representatives of industry, health, all the interested parties will be sitting at the table to structure this to be defined, and there will be change through a process. VGB, Congress. So just want to make it clear, because we continue to hear this. Model Code, is it just another VGB? No, I hope you see from this it is not. It's vastly different. Okay, again, a little bit about the process. We do have a steering committee, 10 members, and we like to think of that as more of the editorial board on this. We have three very important people that help us. Our coordinator, Lee Tate, assistant directors, Amanda Terrier, formerly Amanda Long, for those that been involved in the emails and conferences, and a technical writer with CDC that's helping put this all together, proper editing and verbiage and structure. The work is being done at the technical committee levels, 12 technical committees. They evaluate the research and common practices and develop the model language. And there's back and forth between tech committee and steering committee to determine what goes, are we on target with our technical issues? And one of the, I think, important roles that the steering committee plays too is from a technical committee standpoint, here's the science, here's the research, it supports this. We review it from a steering committee standpoint. We know we agree with you. The science and data supports it, but that's not how the industry does it. And if we tried to put that in right now, there would be no support. It would be just down the tubes. So our mantra is evolution, not revolution. So we use, again, that little the overview editorial control to say, yes, we agree with it, but in the annex discussion, indicate where we would like to go with it, but at this time, we're not for these reasons, and I'll gradually build it in because we don't want to just turn the world upside down because nobody's going to accept it. It's not going to be adopted, and all this work and all the good work and process is all for naught if nobody's going to embrace it and adopt it. Okay, just our steering committee membership, we tried to get broad membership on there, public health, we've got industry, we've got designers, and we have operators on there. And a number of folks here today in the room and at the conference are members of the steering committee. Importantly, too, are technical committees. Right now there's 12 technical committees. These are the technical persons that are the chairs. There's anywhere, I think it's a minimum of 6 or 8 on a committee up to a maximum of 16. And by design, it has to be broad to the extent possible. It includes all the kind of constituents of the aquatics. You need aquatics designers or industry, you need health, you need academia. Operators are all by design have to be incorporated as members of each of these committees. One thing, and this is where I'm going to ask for your help and your input, we're forming a 13th committee. And I want folks to think about whether you yourselves would volunteer your efforts on this or somebody you know would be good. What do we want out of that 13th committee as we're nearing getting closer to a complete package? We need to get implementation, basically a marketing strategy out there. There's still misinformation, lack of information about what the model code is, what the role of it is, and we'd really look for some folks to give us a direction on how to go about reaching out to the industry. We know there's health. The adoption is really at a government type level, so that still will be included, but how do you reach out to the industry from an awareness standpoint and operators? So we need some expertise on there on developing that strategy, so consider it like implementation, easy for you to say, implementation and marketing right now. So I'm hoping after this conference that you'll email us or give us a call as to if you're interested in participating on developing this, or you know somebody that would be very good at this. And probably need just a small core, give us a direction, path, some ideas. We can have the best information in the world, a good code, all technically sound, but if we can't get it out there and people don't know what it is and how do we get it out for, it, again, it's still this piece of paper sitting here, or stack of paper. Okay, now the status of things. There are 12 modules that are in various degrees of steering committee review. And as I said, as each model is completed, there's a process in CDC for clearance before it can go out for publication. They've streamlined that so we can move things faster. So once they've been cleared by the steering committee, cleared by CDC clearance, they go out for a 60-day public comment period. And we've got the website on here on where to access that information. As I said earlier, once we evaluate any of the comments that come in and make changes as necessary based on the public comment, and then they'll be posted for review. But all modules, all the 12 modules, once they're all complete, we've had the 60-day comment, made revisions, the entire document with all the modules will be posted for a final time to allow the context instead of a module here. See how it fits in the entire document, how they integrate the different sections. And that'll be posted once again as a complete document for another 60-day, minimum of 60-day public comment period. And then, like I said, we're going to revise that through a process similar to the Conference of Food Protection. So, status of the modules right now, there's been modules that have been released already, and you may have already, operator training was released, public comment evaluated, changes made, reposted, and we moved this up a little bit on having it more finalized if you will. It's not final, but a lot of requests from health departments that did not have operator training, that were looking to have operator training. We didn't want to have to wait for this whole process for them to have a module to be used. So that's really available in a semi-final draft or semi-final document for folks to use. We think it's very sound, and it's been, from my understanding, used out there by some of the local health departments. Ventilation and air quality was released early in the year. Public comment period was over in the summer. We've received a number of comments. The comments have been shared with the technical committee. They're in the process of evaluating those comments and making their recommendations on what should be altered or how we should respond to those comments. Risk management and safety, I don't know if anybody's seen that, but that was released a few weeks ago. The public comment period ends November 18th. So those are ones that are really actively out there, been posted, finalized from a public comment period, or ones that you need to pay attention to and look at and get back to us on that. Modules to be released imminently, and that really is imminently. The first two facility maintenance and operation and hygiene facilities have gone through the CDC clearance. I think when Michael Beach gets back to the office next week, those will be posted on the website for the public comment period. So look for those two modules. Regulatory program administration is getting final tweaking before it goes into clearance, and that will be posted as soon as it comes out of clearance, which, again, it's been an expedited process, so things have been moving pretty good on that. So those are right, I think imminent is pretty accurate on those particular modules. We've got the next layer, 4 modules that are undergoing basically final discussions between the steering committee and the technical committee. We've seen multiple iterations, the steering committee, of the drafts. We've had comments, questions, back and forth tech committee asking for feedback. So disinfection water quality is one where it's under final, I shouldn't say final, it's under review by the technical committee to respond to some of our latest comments, and we're hoping that those will be resolved shortly to then move into the clearance process. Lifeguarding, bather supervision, again, we're back and forth. A bit of work still between the steering committee and technical committee. They're developing the annex material, finalizing the annex material now for that particular module. Facility design and construction is a very large module. They've done a very good job on putting that together. The steering committee met for a day and a half here at the upfront part of the conference, which, again, we thank National Swimming Pool Foundation for affording us the opportunity to meet as a steering committee. We get so much done on a face-to-face instead of conference calls, but we've finished up the steering committee's comments on the facility design and construction. That will be going back to the technical committee to just clean up and address our comments, but we expect that to be a pretty smooth process. And contamination burden, that is interesting, not like a regulatory aspect, here's how you do things. It's more of a concept. It's more annex discussion on contamination burden. We think of bather load historically. You design your pool and your treatment system on bather load, but what does that really mean? It really boils down to a contamination burden. What does the pool treatment plant have to deal with? You know, what are the chemical, biological factors that affect water quality? And contamination burden is a different and more, and it wasn't not a simple task, so that's what's included in that particular module, but that should be coming out also in the near future. And the last 2 modules that are need a bit more work with the technical committees is the recirculation system and filtration and the monitoring and testing modules. And those committees will be working. We're looking at some enhanced expedited, not expedited in the sense of short-cutting, due diligence on that, but trying to set up a process for those folks to meet and try to get through the information in a more efficient way. So that's the status of the 12 modules. What I wanted to do now is hit some key elements of each of not every one of the 12, but some of the main modules. What is it that you might expect to see? What might be different in these modules than what you've typically done? And some of this may not be new, but I wanted to highlight some of these. Again, operator training, what's the issue? Increased pool code violations have been linked to lack of pool operator training. Those in this room are probably aware of that from various levels of your involvement. Those violations, the nature of the violations, are probably linked to an increased potential that you're going to have health effects, disease transmission, injuries. So that's the significance of why we're tackling this particular module. So this operator training module, it's a first step towards getting adequate training to pool operators out there at all aquatic facilities. Some key elements: training curricula, course elements are included in on what a curricula has to contain. So we had representatives of all the major training organizations and a consensus of, okay, what are the key elements that an operator training course should provide? So if your new entrepreneur wants to develop a training course, this will detail all the components. You put a course together, here's the key items that must be included in the course. Also the instructor qualifications. What are the minimum standards, or what do you need from an instructor to be effectively communicate that information? And they agree a certificate validity period of 5 years maximum right now. So those are some of the key elements. Now the regulatory program administration module, which is a different module, and that's where I say the cross-linking on a complete package will make this a little bit easier to digest it all. But that will require trained operators at all aquatic facilities. But that doesn't necessarily mean, and there's a recognition that your small pools, mom and pop, motel, do you expect to have that trained operator there 24/7 or 8 hours a day? There's a recognition of those aspects of it, so the answer to that is no. They still have to have a trained operator, but that trained operator may be off-site. As I recall, it might be at least a weekly basis has to visit that, and there has to be a structure set up and communication on who is on site, what they're expected to do, and that communication link between the trained operator. The larger, more complex facilities, which again will be detailed in the regulatory program administration, will say what types of facilities it feels it's important that that operator be on site.